So, my camera on Facebook, I can't see myself. Can you guys see me? What is going on in social media today? I can't get sound or video. Can anyone hear me or see me? This is crazy. All right, guys, you're back. Can you hear me on Instagram? Facebook, hopefully you can see me because I can't see myself. So anyway, we're just gonna dive in and we're just gonna go with it. So here we are. So happy Monday. I am Dr. Trisha Pingel, and this is your morning checkup on this Monday. And I see that there's people out there on Facebook. I cannot see anything. So if you guys have any trouble over there, just holler. I guess it's one of those days where everybody's on social media, and so therefore they're gonna, slow the stream down for me, whatever. So that is okay. We're gonna talk about something today that many of you may not really know about, which I think is very, very important, and it is the Eastern philosophy of medicine, or traditional Chinese medicine, which has a very different in a different philosophy to it. And as a naturopathic physician, my goal is to always combine both disciplines. Look at the Eastern philosophy, look at the Western philosophy, and come up with an individualized treatment. Now, a lot of the herbs that I use for adrenal fatigue, for insomnia, for, thyroid, all of these things are the same herbs that are used in traditional Chinese medicine. However, they might be used differently, and I think that's a really big point. When we look at pharmaceuticals, there's usually one mechanism of action. So for example, a blood pressure medication may block maybe a beta blocker, but it doesn't do anything else. That's all it does, right? Where in plants, they have multiple mechanism of actions. They have multiple things that they do, okay? So you can use the same plant for multiple things, which is crazy and is exciting, and it allows for us to treat the person as a whole, as opposed to just suppressing a symptom. And I think right now, this is pretty relevant, the TCM model, because it's based on us being part of nature. That's right. We're not better than nature. We're not above nature. We're not superior to nature. We are nature. And I think that's a really important point. And if we go against nature and we continue to fight nature and we continue to fight as if we're better than it, we're not going to end up any healthier. I think we have to treat ourselves holistically and as part of the universe. And so that's kind of the goal of traditional Chinese medicine. So I want to talk about their philosophy, which can be very confusing, okay? Traditional Chinese medicine definitely takes a lot of skill, but I'm going to try to give you the nuts and bolts, the little bit of it, and see if I can't teach you just to kind of look at your situation a little bit differently. So good morning, everyone. Nice to see you. Good morning. About 1/3 of Americans regularly use complementary and alternative medicine as their primary method of treatment. Okay, so very, very popular, and we call it complementary and alternative, but it's really not, right? It's been around for 2,000 years. Traditional Chinese medicine has been around for a very long time, and plants have been around for a very long time, and they've been used in medicinal aspects. Now, traditional Chinese medicine has different approaches to it, okay? So typically, there's a use of herbs using plants as medicine. There's also acupuncture, which I'll do a different live on to follow up, just to keep educating you. And then there's also Tai Chi, some sort of movement that works with the universe and nature. So let's talk about kind of how it differs from Western philosophy. When I look at Western philosophy of medicine, that is what most of you out there are the most familiar with. You have a symptom, you go to the doctor, you suppress the symptom. So I have a cold, so I'm going to go and I'm going to take a cold medicine. Or I have high blood pressure, so I'm going to take a blood pressure medicine to bring that blood pressure down. In the naturopathic philosophy, as I've talked about numerous times, if you block a freeway, right, an exit on a freeway, you're going to have to find a way to divert. So oftentimes taking some of those suppressive medications can actually cause more symptoms, and that's where side effects come in, right? And then you have to treat the side effect. So the Eastern philosophy is quite different, right? It finds a way to open up that overpass. gently and easily, maybe less traffic, but it finds a way to rebalance and fix that faster so that the symptom actually goes away from supportive therapy as opposed to suppressive therapy. But we're kind of in this mindset of suppressive therapy. We get sick, we want to know how to kill it. How are we going to kill it? How are we going to get rid of it? How are we never going to see it again? You know, what can we take to suppress it and kill it? When really what we might need to be doing is, you know, supporting our body to clear things, right? So different philosophy. At its core, TCM, or traditional Chinese medicine, is based on the ancient Chinese philosophy that all humans are part of the same universe, okay? And as a result, we're connected to nature and we're subject to all of its forces. We're subject to wind, we're subject to heat, we're subject to cold, you know, we're subject to the earth, we're subject to the dirt, right? All of these types of things. Good morning, Sarah. Nice to see you. So it's based on this, that we're all part of the universe. We're all part of one, right? We're not against it. We're not better than it. We are all part of it, which is what I try to teach my children in times like today with our weekend, is that we're all part of a nature. We're all part of a cycle. And that is what this type of medicine is rooted in. So according to Chinese medicine, you may have heard of this thing called qi. And I'm going to try to explain this the best I can without all of you just totally going, okay, yeah, she's lost me, because this is tough. This is a tough concept. I want to say I spent many years in medical school learning traditional Chinese medicine, and then I had to sit for my boards in traditional Chinese medicine and acupuncture, and let me tell you, hands down, probably the hardest board that I sat for. Far surpassed biochemistry, physiology, pharmacology, microbiology, all these things that people deem hard. Traditional Chinese medicine was very difficult because it goes completely against what we were taught, right? Completely against what modern medicine has told us it is. And so it's very hard to understand this concept. So they're basing this off meridians and qi. So what that basically means is that we all have energy that flows through our body. Okay, and it flows through in these channels. So if you could imagine it like a freeway, or even like just your blood flowing through your heart, right? If you have plaque there and it can't flow, it causes a backup, right? And when you have that backup, you have a heart attack, or you have high blood pressure, you have some sort of symptom. So think of qi like that. It's moving through what the traditional Chinese medicine bases on, what are called meridians. Now, in Western philosophy, we look at the liver, we look at the heart, we look at the lungs, we look at these individual organs. They do that in traditional Chinese medicine as well, but they believe that there's an energy that flows through those organs and through the body to keep those organs working appropriately. So these meridians may not land on top of the organ. For example, the lung meridian actually starts on the hand and moves up the arm. So does the large intestine, right? You think, why would the large intestine be on the upper part of the body? That's where that energy flows. So when they're doing things like acupuncture, things like that, and they're triggering certain parts of the meridian in order to balance out the flow of qi throughout the organs. Now, what could stop this qi from going through the organs? What do I mean by that? What exactly am I talking about? So there's this concept called yin and yang that I think most of you maybe have heard about, but may not understand. So for example, if you take a shower, you don't want the shower too hot and you don't want the shower too cold, right? You want it just right, like Goldilocks, right? You want it just the right temperature. The proper optimal balance is the right combination between two opposites. You don't want it too hot, you don't want it too cold, you want it warm, right? So it's a combination. So same thing as wet or dry. You don't want anything too wet, you don't want anything too dry. I'm just letting poor Facebook know where I am on Instagram. These are balances of hot, cold, cold, wet, dry, hard, soft, like anything that's opposite is part of this yin yang balance, and you want them to be balanced. So for example, if you have blood trying to go through the heart and there's something blocking it, that becomes stagnated, right? And when it becomes stagnated, it becomes inflamed, and that creates heat. Now you may have cool areas in the rest of the body that you need to transport to that area to make it the right temperature, right? So it's all based on the elements. It's based on earth, wind, hot, cold. We look at blood, we look at whether something is excess or deficient. So do you have too much heat, too little heat? Is the water too hot or too cold, right? And then what do you do if you're in the shower and your shower is too cold? What do? You turn up the heat a little, right? So you adjust it to get it just where it needs to be. And that's basically what traditional Chinese medicine does. Instead of suppressing it or, you know, putting something else in there, a diverter to change the temperature of the water, you balance it out yourself to your optimal. And that's what it does. And that's kind of what it's based on. Very, very complicated, very, very confusing if you don't understand it. And thank goodness there's people out there that are trained in this. And people who are trained in traditional Chinese medicine where they get this as fast as a Western doctor gets pharmacology, okay? And I suggest you lean on these people. You lean on these people that have gone through this training, because trust me, I went through this training and I don't practice it on a daily basis. So to me, I still have to look things up, but I absolutely respect those that do this on a daily basis, because this is a very complicated subject, okay? But works very well. And it goes with supporting the body to heal rather than suppressing the body to heal, okay? The arena I fall in my medicine and integrative medicine is, you know, sometimes I have to suppress, sometimes I have to support. Well, you don't always have to suppress, right? If you follow traditional Chinese medicine. I try to bring the two disciplines together because that's what patients can understand. But there is a lot to be learned from this type of medicine. So, as kind of, well, let me give you an example, another example, which is kind of interesting. So, you know, we look at things like upper respiratory illness. You have an upper respiratory tract infection, you go to the doctor, you go to the Western doctor, and they say, oh, well, you have an upper respiratory tract infection, here's an antibiotic, or here's an antiviral, or here's something to kill that infection. Well, you may go to the Chinese medicine doctor, and they may say, oh, well, your lung has external wind cold. And you go, excuse me? External wind cold? What are you talking about? And then they put some, you know, some points in an area that bring in heat, clear wind, and open up the lung channel, and all of a sudden you feel better. And you go, wow, that's pretty crazy, right? Another example, you may visit your traditional doctor and have multiple problems. You may walk in and say, you know what, my periods are awful, they're heavy, I'm not sleeping, you know, I just have been generally worrying lately and I'm just like not myself, you know, doc, could you check me out? And they say, well, we'll refer you to a gynecologist for the period issue, we'll give you an antidepressant for how you feel, and we'll send you to a sleep study to deal with the insomnia. Where in traditional Chinese medicine, they may take a look at your tongue and pulse, which we're going to talk about in a second, and they may say, well, you have heart fire. And they clear the heat, clear the fire, and all the symptoms go away. There's no referrals out to other practitioners, right? So think about if this is used appropriately, how many less office visits there would be, right? So I think this side of philosophy is really important, especially now with us trying to struggle to find new drugs and find new therapies for conditions that have really been around a very long time that traditional Chinese medicine is having pretty good impact on. So kind of cool. So I'm going to talk about the tongue and the pulse because I think that's probably what most people are interested in when it comes to this. But I want to give you a real quick insight to basically the three things that you're looking at when you go to a Chinese medicine doctor. So if you go there and you get this weird diagnosis, you know what it means. Number one, they always want to know what meridian is infected or affected. Is it the lung? Is it the large intestine? Is it the spleen? You know, what's impacted and what elements are impacted, okay? And is it excess or deficient? So often, someone's never asked you how much water you drink. Oh, Desiree, that's a bummer. That's critical to survival. If you didn't watch the dehydration live, go back and watch that. Critical. So they want to know whether something's excess or deficient. So are you qi deficient, qi excess? Do you have too much heat, too little heat? Too much cold, too little cold, right? Those types of things are what they're looking for. And then they base the treatment off what you have. Okay, so if you have too much of something, they're going to clear that out. If you have too little of something, they're going to build that up. All in the purpose of finding that warm, perfect water, right? That you have in a shower, right? And that's where that example about the typical doctor with multiple symptoms comes in. Sometimes it doesn't require multiple treatments. Sometimes it's all underlying to the same root cause, which is the heart of naturopathic medicine, which I consider naturopathic medicine to kind of be a blend between traditional Chinese medicine, Eastern medicine, and Western medicine, and finding a common ground in the middle where we can use the benefits of both types of medicine together and treat a person holistically. And I think that's where naturopathic medicine has a unique perspective on health, because we have the training in both sides to be able to say, okay, well, this is the benefit over here and this is the benefit over here, so let's apply this and make it work for everybody. And I think that's the beauty of naturopathic medicine. For those of you that ask me, what is it? Why should we see a naturopathic provider? That's why, because there's a benefit of both worlds, right? There's a lot more information out there than we're always told, and that we have access to. So let's talk about your tongue. So I know that all of you are gonna run out after this live and look in the mirror at your tongue, aren't you? And many of you might feel your pulse because you wanna know, what's my Chinese medicine diagnosis? I so wish it was that simple. It is so not that simple, but I will give you some general guidelines. So I have on the article linked with this, a book about Chinese medicine I recommend. You know, I have them at my actual office. I don't have them at my home office, but they're intended for medical professionals, so it's kind of hard to, I'll have to come back to you on that one. I can't remember the name. I'll have to go to my office and take a picture of it for you. But so tongue. So they look at tongue and pulse as diagnosis. So basically looking at what's happening on your tongue, compare it to what's happening in your pulse, and then also taking in the symptoms and putting those all together in a clinical picture, which tell us what's excess and what's not. So I have on this article on TCM on my website, I did link to it on Facebook. I can put it below this on the live for Instagram. There's a TCM tongue map, okay, where in general, if you were to stick out your tongue, you can look at areas of your tongue and know which meridian is impacted. So in general, the back of the tongue, at the root of the tongue, tends to be more kidney and urinary. The sides of the tongue tend to be more liver and gallbladder. The back middle is more large and small intestines. The middle is the stomach and the spleen. And then you've got the lungs, and then you've got the heart at the tip. I bet if you were ever really angry about something, like really, really angry or hurt, or like when your heart hurts from pain, often when you look at your tongue, the tip of your tongue will be bright red. Heat in the heart. Happens a lot. What I see most commonly, particular people with have poor liver detoxification, is the sides of their tongues will be scalloped or swollen. So what you're looking for is, I'll tell you what you're looking at when you look at your tongue. So those areas tell you what meridian may be impacted. Now that doesn't mean the organ. Let me be clear. If your liver meridian is impacted, that doesn't mean there's something wrong with your liver, okay? The liver meridian plays into a bunch of different things. There's emotional aspects. There's all these different elements associated with it. So please don't take that, okay? If you see a part that's impacted, that doesn't mean there's disease there. That's Western thought, okay? We're going Eastern thought. That means that meridian has a problem with flow of qi. If you don't correct it, it could lead to problems in those organs, but it does not mean that the organ itself has anything wrong. So you could see that you have redness along the exterior of your tongue and go, oh my God, something's wrong with my liver. Go get your liver checked and it's 100% fine. But you might need to look at what the liver meridian means in the Eastern philosophy, which I could spend all day talking about. I'm not gonna do that today. I'll try to incorporate it in over this week and next week so you can learn. But I wanna be clear. This is not Western medicine. This is Eastern medicine, okay? So when you look at the tongue, number one, looking at the color of the tongue, okay? Is it pale? Is it red? Is it purple? Right? Those all mean different things. Pale would mean that there's a lot of cold, particularly if there's a very thick coating, particularly a thick white coating, usually means that you have excess cold. So you might see that if somebody has a respiratory tract infection, for example. Spleen qi deficiency, which has a lot more to do with digestion. I know I said spleen, that's going to confuse you in Western thought, but spleen has a lot to do with digestion. Are you breaking food down? That meridian plays a role in what goes in your mouth and what comes out. So if you have a lot of deficiency in that meridian, you'll see paleness on the tongue in the area of the spleen. About right there. Blood deficiency, so not getting enough blood flow and oxygen through the body. Red usually means heat. Now, excessive heat will have a yellow coating. Now, for those of you that just took a sip of coffee, you will get a yellow coating. Don't freak out. That's coffee. scrape it off. But if you have a yellow coating anyway without drinking coffee, usually that means there's some sort of excessive heat somewhere, okay? You'll also see that with infections if the infection disturbs the heat. Yin deficiencies, those are what you're looking for. Redness, paleness, purple means something stagnated. That means that that freeway I talked about earlier is blocked. Okay, something's stopping it from going somewhere. So you'll see that in a lot of stagnant conditions, right? Red tipped tongue. Now I just talked about that a second ago. The tip of the tongue is related to the heart, okay? So you will see a lot happen on the tip of the tongue. Often if there's a lot of emotion, grief, anger, hurt heart, you will see more redness on the tongue. That's an indication to you that perhaps there's some emotional work that needs to be done as well. Eastern philosophy, like I said, it doesn't mean something's wrong with your heart at all. Your physical heart could be 100% fine, but your emotional heart might not be. Okay? So you have to look at this from a mind, body, holistic perspective. We are all one with nature. It does not mean you have a disease of the heart. It means something is wrong in that meridian. That meridian is affected by grief. That meridian is affected by pain, right? When my mom died, the tip of my tongue was more red. Why? Because I was grieving, okay? And I had to work through that grief, right? And I did that with Reiki and energy therapy and things like that, which opened up that meridian, right? I also did it through certain types of exercises like Tai Chi and yoga, which move meridians as well. So we have to go against that culture that there's something wrong with our heart. I see a lot of people with anxiety. I'm going to guess with the current world events, a lot of people have a red tipped tongue right now. If you keep that up, yes, it could impact the heart, right? If you keep up anxiety and anger, you will impact the heart. You will also impact your detoxification, your ability to break nutrients from food. That puts stress on your body. So if you're someone saying, gosh, am I impacted by stress and emotion? Check your tongue, right? Living in this environment right now can bring out a lot of emotion, and that's going to affect our health, okay? So the tip of the tongue is related to the heart, the fire. When it's red, it's an indication that there's emotional distress that's coming from some sort of imbalance. This fast-paced lifestyle that we live, this epidemic of stress and anxiety, it's very common to see a red-tipped tongue. In addition to that, heart imbalance can also cause things like nightmares, restlessness, agitation, mouth ulcers, heat sensation in the chest, dry mouth, okay? So we're not talking about heart always, okay? So we kind of talked about where it was. So you're looking at where the location is, what the color of it is, the shape and size of the tongue. If the tongue is swollen or puffy, now what does that mean? I'll give you an example because I always have this. You get to see my tongue today. Aren't you excited? On the outside of my tongue, you'll notice that it's kind of scalloped, okay? Huh? And a little bit red. You see that, Facebook? I can't see my camera. Why is that? My main issue that I have to look at is digestion. I have poor digestion, right? I always have. I support my digestion very well. I have genes for celiac. I have a lot of things that I have repaired in my health. But the one place I still see it is on the edges of my tongue. Now, if I compare my tongue, though, to 10 years ago, it was way scalloped and swollen, right? So I know when I eat something that doesn't agree with me, my tongue will get more swollen. Kind of cool, right? Because it tells me, my body's telling me, it's like, hey, whoa, hold up. You're messing with your chi. Slow down, right? So swollen or puffy usually means some sort of damp heat, some sort of trouble digesting nutrients. If your tongue is very thin, it usually means that you're very deficient. You'll see this in people who might have gone through chemotherapy or, are at end of life. You'll see their tongue get very thin, right? Because their vital force, the energy that fuels their body is deficient. So that's what you can see with that. Trembling. If your tongue trembles when you hang it out, that usually means there's a spleen chi deficiency. So your body is deficient. It's trying to make up for that and it makes it tremble. Some people's tongues are elongated or their sides curl up. Naturally, not forcing it to do it, not using that muscle, but their sides just cure up. A lot of that means there's some issues in the liver, or the liver meridian, I should say. Cracks in the tongue. Typically, there's some sort of excess heat or yin deficiency if you have cracks in your tongue. Lots of nutrient deficiencies come from that. Definitely see a Chinese medicine provider if you have cracks in your tongue. I don't have an example for you because I have no cracks in my tongue, okay? okay? Tongue coating, as I talked about earlier, yellow coatings, white coatings that are not related to what you ate, okay? Those types of things also vary in color. You have people who could have a brown coating, a gray coating, a black coating. Now, if you have a black coating, that's big. That's a big deal. Most people don't, okay? You're definitely, there's issues going on if you do. But I do see a lot of yellow coatings and white coatings, and whether they're thin or thick, okay? Those types of things indicate different things. A thick coating will be excess of something, whether it's excess of heat, whether it's excess of cold, whether it's excess of wind, we don't know. That's where the pulse comes in, okay? So those are things just to kind of take a look at on your tongue. Did that help you guys? Is everyone out there like this? Looking in the mirror? But you know, your tongue tells you a lot. Watch your tongue. The next time you get sick, look at your tongue. Take a note of it. And then when you get well, look at your tongue again. It will change. Now, there's the same type of thing with pulse, and I'm not going to go through all the different pulses today. It would take me forever. But when you look at the tongue and you determine, is there excess of something, what meridians are impacted, and then you check your pulse tells different stories as well. And that's how they come up with the diagnosis. So when you feel your pulse, sometimes it may be soft. It may be like a guitar string where it's like bing, 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 bing. It may be very forceful. You know, I can hear my husband's heart from like practically across the room. I mean, he's got this forceful pulse, right? Mine, sometimes you can hardly find it, right? So you have to know what's normal for you, but then also know what those things mean. Those things indicate certain excesses or deficiencies. When you combine that with the tongue, you get a diagnosis that sounds crazy, like you have excess wind heat. And then they use Tai Chi, acupuncture points, and herbs to clear that heat, improve your health. So kind of cool little things. I do have an article on this. Check it out. I also have an article on acupuncture, and I'm going to do a live on that as well, because I think if we can learn more about this philosophy and we can really walk away with the main point here, which is we are all part of nature. We are all energy. We share energy with each other. We move energy through ourselves. And when the energy is not moving, we have a symptom. So you either suppress that symptom and cause more blockages in energy, or you learn how to unblock the system. And that's what Chinese medicine does. That's why it's such a valuable part of medicine. And unfortunately, so many people discount it. So many people just, oh, well, there's no studies on that. By the way, folks, there are so many studies on Chinese medicine. It's unreal, okay? So many. It is not a lost art. It is not an art that is not proven. It is absolutely proven. And a lot of the herbs, like I said earlier, that I use for different conditions are also used in Chinese medicine for other things, okay? So always remember to take a look at this holistically. Now, some of the herbs I'm not going to go into detail on, but some of the main herbs that I listed in the article, if you'd like to check them out, astragalus, cinnamon, ginger, licorice root, Shishandra berry, right? Those are ones that definitely are used a lot in the Chinese medicine philosophy, and ones that I'm going to do lives on if I haven't already. So I did do a live on cinnamon already. Now, I was giving you more of the Western uses of cinnamon at that point, right? Blood sugar, that type of thing. But when you're looking at the Eastern philosophy, it's that moment, okay? We're looking at what's going on in that moment. What's happening right now? What is nature doing? What forces of nature are going against your body, and how do we unblock that? Where Western medicine picks a diagnosis, and that's a diagnosis you have for life, right? Oh, you have diabetes. Okay, well, you have diabetes. And the next time you go to the doctor, oh, you have diabetes. They don't check it again. They just assume you still have it, right? But if they were checking your tongue and pulse every time, maybe the diagnosis would change slightly. Maybe the things impacting you from nature would change slightly. So think about how much we could get done if we combine those two disciplines. I think a lot. A lot of you were asking about books that I recommend. Like I said earlier, most of my books are at my physical office, and I'm at my home office. And I don't think I have any, but I'll have to pull some up for you. A lot of them are pretty technical. And a lot of them were put together by naturopaths even, and by other Chinese medicine doctors when I was in med school. So I'll see if I can find some. But I just wanted to call you guys, your attention to different aspects of medicine, and that what you read about every single day, what you see in the media, what you see about suppressing illness, there are other viewpoints to that. There are other viewpoints. There are other therapies that work more with supporting the system. And by learning more about them, to me, that only arms you with more information. It might also lessen some fear on certain things, which I think is important too, because fear decreases your immune system. Fear causes a lot of heart fire. And then, you know, it may cause you to react emotionally, which, as we're seeing right now, you know, can cause harm to a lot of people. So remember, we're all part of nature. We're all sharing energy. Hopefully you enjoyed this energy sharing with me today. I certainly loved being here on this Monday with all of you. And I'm so sorry that Facebook was having some issues, but you know, hey, I'll post them both, okay? Thoughts regarding Lyme and cytokine storm. Thanks, Camby. That's a topic for another day. I don't know if I can go into that one right now. That would be a whole live in itself, but I do appreciate the question and I'll consider addressing it in a different live. Thank you to all of you. Thank you for your questions. Thank you for being here. Much love to all of you. Please be kind to each other. Just be kind. It's not going to hurt. Okay? And much love. Have a great day and have a wonderful week. And I'll see you tomorrow around the same time. Talk to you later. Bye-bye.